Welcome, I'm Dr. Mike DeBoer, president of B3 Sciences. In this short video, we're going to share with you a new breakthrough in exercise technology that is going to be a wonderful way for people to improve vein health. Well, we all know the benefits of exercise. A book, Younger Next Year, spells it out for us perfectly. We need to exercise 5 to 6 days per week, and it's a combination of vigorous or serious aerobic exercise, that 30 to 45 minutes of vigorous aerobic exercise, and then a couple days a week of strength training that maintains health and specifically cardiovascular health. Here's what the U.S. Department of Labor states, that we need vigorous exercise from the time we're kids to the time we're adults, and even older adults need at least 150 minutes per week. And they're not talking about light walking. They're talking about vigorous exercise that maintains cardiovascular health. And this is very important for venous health. Here's what Harvard Health says. When you walk, the contractions of your calf muscles help force blood back towards the heart. Your veins are going to benefit from the recommended 30 minutes of moderate exercise every day. So here Harvard is telling us we need to be exercising every day, but it needs to be moderate intensity, meaning not just a light walk up and down the street. We need to exercise our legs and our cardiovascular system with vigorous walking or light jogging, or things such as walking, swimming, strength training, or yoga, which Harvard says all promotes healthy blood flow and strong veins. And it maintains what's called venous compliance. We're going to talk about this. Venous compliance is the ability for blood. Every time your heart pumps, a certain amount of blood goes through your veins due to the ability for the vein, for the valve in the vein to open, and for the vein to be able to open and close and move that blood through. And again, when you have strong legs, strong veins from doing vigorous exercise, you have no problems. You have strong venous compliance. But when we live a poor lifestyle, when we sit and stand all day and we don't get this exercise recommended, the veins in our legs lose their ability to expand and contract and move blood back to the heart. Look at the picture over there. You can see that blood is actually starting to leak back through that valve due to a lazy or vein that doesn't have strong venous compliance. And we all know what happens when that blood starts to pool backwards. Doctors call it venous insufficiency. It's when your veins have trouble sending blood from your limbs back to the heart. In this condition, blood doesn't flow back properly, causing blood to pool in your veins and your legs. And you can have things like swelling in your legs, pain in your legs, varicose veins. You can even get problems with circulation in your legs. Well, none of us want to end up with this type of condition that leads to these horrible problems in our legs. But we have a population where very few people are able to do this exercise. Very few people rarely are doing vigorous exercise, either due to time, they don't have 30 to 45 minutes per day, or some people have pain, they just can't tolerate it. And many people who are doing light exercise, it's not vigorous enough to create that wonderful venous compliance and strong veins. And again, remember, Harvard said moderate or vigorous 30 minutes per day. And now many of us are dealing with being confined to home. Well, that's why B3 bands are such an exciting breakthrough. This technology was discovered over 40 years ago in Japan, and it has been proven there with a big data bank of research. When it was brought here to the United States about 6 years ago, it was proven in our Olympic athletes. And now with B3 Sciences taking this technology out to everyone across the United States, we have over 8,500 people and growing. And BFR, like using B3 bands, which we're going to talk about, it's proven to simulate this vigorous exercise that Harvard recommends we get, but you're going to be doing much less exercise and much less intensity. And it's as safe as regular exercise. People from all walks of life, 18, 90 years old, busy moms and dads, kids and seniors, athletes at all levels, people in pain, people with early cardiovascular disease like varicose veins and venous insufficiency, even people that are injury or rehab or are physically challenged. How does it work? Well, when you put the bands on your arms and legs, as you can see the people in that picture right there, it gently squeezes your arms and legs. What does that do? That slows down oxygen flowing into the muscle. So I want you to imagine you're going to go for a light bike ride, not vigorous, just light, or do some light swimming or light yoga or light walking. And as soon as you start doing this, you'll notice your muscles will start to fatigue. Why? Because we've reduced the oxygen flowing in and flowing out. And then you get that vital, that beneficial exercise burn, that feeling in your legs that you are doing moderate or vigorous activity. Now, you're only doing light exercise, but you're getting a deeper fatigue, and you're going to get a big response from the body. You're going to be doing something relatively light for 10 to 15 minutes, but your body's going to think you're doing vigorous exercise for 30 minutes. And best of all, in most cases, no pain or soreness. Here's a study showing you exactly how this works. This is middle-aged men doing bicep curls, or what is referred to as normal exercise. And in this study, they're measuring oxygen. If you look there on the screen on the left, they are getting down around 30 to 35% oxygen when they get to fatigue. And this is not vigorous enough to release growth hormone in the body and release other wonderful substances that can benefit the cardiovascular system. We'll talk about it. Now look at the right side. This is the same men putting bands on like B3 bands and doing lighter weight, light weightlifting. Look how deep the fatigue is they're hitting, down around 30%, 20%. Why is this so important? Why is it so important when you exercise to feel that light burn, or what some people call lactic acid? Because when you get that, when you feel that light burn and produce lactic acid, your body responds. Look at this study. And we have 7 studies posted on our website. In this study, these men experienced a 25 times increase in growth hormone. What does this mean? This means you can go for a walk or a ride on a bike or do some chores around the house, or even walk around the house with the bands, feel that wonderful light burn in your legs like you're doing vigorous exercise, and get a growth hormone release, which has tremendous health benefits. But guess what else happens? Your body releases a substance called nitric oxide, and it has tremendous benefits, of which it increases elasticity in your blood vessels. Now, let me repeat this. When you do light BFR exercise, and this is an actual study posted down there in the bottom left corner of people doing BFR like B3 bands, this creates a hypoxia, or a drop in oxygen, and it stimulates nitric oxide and improves the elasticity of all your blood vessels, including your arteries and your veins. Next, also, you get a release of what's called vascular endothelial growth factor. Why is this so important? Because when you get this, your body creates new and younger blood vessels. That means it's going to stimulate vascular remodeling. Why is that so important? As your arteries and veins start to deteriorate, these two wonderful substances, nitric oxide, vascular endothelial growth factor, actually improve the flexibility of your blood vessels. Here's the problem. Most people, especially seniors, cannot do vigorous enough exercise to get nitric oxide and to get vascular endothelial growth factor. This is why Harvard says it's so important, because these are the substances that are released from the body at any age that keep your cardiovascular system healthy. And look at this study. This is a study on 6 weeks of walk training in women ages 59 to 78 years old. They studied a group without BFR bands on and a group with. Look what the study concluded, that the group that had the bands on, that did the walk on the treadmill, had a significant increase in venous compliance. There was no improvement seen in the group that was just doing normal walking. Now, what does this tell us? This tells us the same thing that doctors and researchers in Harvard are saying. We need vigorous exercise to maintain a strong cardiovascular system and strong and healthy veins. And light walking is not enough. If we could do vigorous walking, we could strengthen our veins and have healthier veins. And this study proves it. And down there in the bottom left corner is the actual study. If you're on our website, you can simply scroll below this video to go read the study. And finally, BFR training is safe. If you are allowed to do normal exercise like walking or biking or yard work or chores around the house or swimming, then you can use BFR bands like B3 bands. There's very few contraindications, but look what this study concluded. BFR training is safe for healthy people and can be applied to persons with various kinds of physical conditions, including cerebrovascular disease, orthopedic disease, obesity, cardiac disease, neuromuscular disease, diabetes, hypertension, and respiratory disease. And here's a study conducted at the University of Texas on the B3B strong bands, showing that when doing walking or yoga, there was no increase in arterial pressure, meaning it's not putting any additional stress on your arteries. And there was no increased oxygen demand on the heart. So this means you can go for a walk around the house, up and down the street, do a light ride on the bike for 10 to 15 minutes or some light yoga, not put any additional stress on the heart, but get the benefits as if you're doing 30 to 45 minutes of vigorous exercise. And as we've just discussed, this is so essential for healthy cardiovascular system and healthy and strong veins. So how do you get started? Well, the first step is to order your B3 man. Simply go out to the website. If you're on the website, click on the shop button and go in there, and there'll be a sizing chart in there where you can measure the upper part of your arms and legs and choose the size that's right for you. As soon as you order, we will send you an exercise program. There's 20 programs to choose from, including the very simple walking program for vein health. And this means you can walk around the house. You can walk around your driveway, down the street, to the park, up and down stairs. You don't need to be concerned if you're confined to the home or having challenges with social distancing. You can do this anywhere. There's also common programs like Lose Weight, Tone Up, Get in Shape, Build Muscle, and Perform Better. And when you order, you will have a personal coach from B3 Sciences that will be there to assist you anytime you have questions. And we even offer a 30-day money-back guarantee. So we want you to try the bands, use them for helping build healthy veins, go for a walk, do light exercise, and try them for 30 days. If for any reason you are not completely satisfied, simply contact us for a full refund minus the shipping fee. We're so confident you're going to love the experience in the bands that we guarantee them. We also have a 0 down, 0 interest program for 6 months. The bands, which will last you several years, you get them for your arms and legs. They cost approximately $429. If you want to pay for this with our payment plan, you can get 0 down, 0 interest for 6 months with PayPal, and as little as approximately $75 per month, you can get started on this wonderful exercise technology. PayPal will even give you $20 off your order when you apply for their credit program. Well, I want to thank you for watching this presentation on this exciting exercise technology that can help assist you with strong and healthy veins. If you're on the website, go ahead and scroll down. We've provided some more information and some of the safety studies, the walking videos down there to show you how easy it is. And we even posted that study that showed that women had significant increases in venous compliance. Again, thanks for watching, and hopefully you're going to order your B3 band so you can be healthy, be fit, and be strong.